Welcome to DentalUnit podcast. This podcast is hosted by me, Dr. Christian Jarry, and my dear friend, pod friend, Dr. Tatiana Deliberador, directly from Brazil. Today's episode, it's a very special one for two reasons. First, because it's the very first episode with an international guest and also held in English. And second, because of the guest. Guess what? I tell you, if I can quote Winston Churchill saying, "Never so many owed so much to so few," I can include our guest in the few bucket because she has been dedicating her life to do nothing but help people in many different layers, either directly treating patients or mentoring students, learning how to do it, or also just that, leading a global organization as a president. It's our honor to have Dr. Charlotte Stilwell with us in our podcast. Thanks for joining us, Charlotte.
Well, thank you very much for having me. It's indeed an honor for me to be here and to be the first international guest. I'm delighted.
Oh, nice. Charlotte, first of all, it's a great pleasure to have you here in our podcast. You are an inspiring woman, and thank you for accepting our invitation. Thank you very much.
Thank you.
Charlotte, first things first.
Okay.
You're originally from Denmark. Beautiful country, by the way. I enjoy Denmark every time I'm there. However, I can tell by your accent, you've been in the UK for quite a while.
I have.
Please share with us, how was your journey like leading your career towards the UK?
Well, I grew up in Denmark and I am still Danish. But
Still.
I am, I could have changed nationality, but I have stuck with my Danish nationality and I'm very proud of it, in fact. It also means I'm still European, which is quite handy. But I think I love my country. I love Denmark and I have a flat there. But as I grew up, my parents were very Anglophile. They were very keen on England and in particular England. And my father worked for an English company. They used to sell X-ray films. And so he would make many trips to England. My mother had been to England shortly after the war, the Second World War. And so that was sort of quite a tradition in the family. So I think I always had this passion and keenness to go to England. And I went as a 16-year-old on language courses and 17-year-old and 18-year-old. And I sort of carried on with that. And somewhere along the lines, I also met an Englishman and I married an Englishman. And when I finished dentistry, actually, I really wanted to travel. And the place I wanted to be was England. So I trained in Denmark, but when I finished, there were no jobs for Danish dentists at all in the early 80s. So it was a sort of perfect combination. I was willing to travel because I had to anyhow, because there were no jobs.
Nice. Did you attend dental school in Denmark? Okay,
I did.
Not in UK. Okay, and
Yes.
And where was it?
In Copenhagen. There are two dental schools in Denmark, and they're quite fierce rivals. So one's always got to be careful in Denmark what you say and where you say it. But I am from the dental school in Copenhagen.
Oh, Copenhagen, nice.
Charlotte, and then you specialize, as we know, in prosthodontics, right? And I'm Team Charlotte, by the way, in the sense that I chose surgery, on the other hand, just so I could restore my own cases, see, the other way around.
Yes.
And I was curious, what was the aha moment for you? What made you fall in love for prosto?
I
Roll
think
the drums.
Yes, and interestingly enough, in the final year at dental school in Copenhagen, I think I felt that when I was working with removable dentures, that was where I was really making a difference to someone's life. And there was also a way of going about these partial dentures in particular in Denmark. It was quite dogmatic, quite strict, but it made sense. And I think I found in preparation for exams that I could really design these dentures and they worked. And somehow that steered me in the direction of speaking to some of my teachers in the removable prosthetic department in Copenhagen And they were the ones who put me in touch with different hospitals in the UK and said, would you be interested to have this Danish dentist working with you in some form or other? And that's how I ended up at what today is Queen Mary University London, QMUL. But in its day, it was the London Hospital Medical College Dental School in Whitechapel, East End.
Nice. It's an empowering feeling, the restorative side of dentistry. I know that some colleagues, for example, Tatiana, she loves perio because of the way that she can convert something so diseased, so disastrous into something very healthy. However, it feels like putting a cherry on a cake, the whole restorative side.
Yes.
It does. And, the other thing, I suppose, is that, and I suppose the word is team, isn't it? I work with a team at the moment. I head up a team. And I think I've always enjoyed that. And as the prosthodontist, it also came out of wanting to be a general dentist, because the more I could do as a general dentist, if I could also do that final thing, which often is the prosthodontic outcome, then I could sort of do the whole journey for the patient. And I think I just enjoyed that. And then the more I got into it, the more I realized that you were also working with all the other colleagues, the multidisciplinary approach. And I really enjoyed that.
It feels like literally you're crowning everybody's work.
Yes. Yes. Yes, that's right. It's
all the meaning of the word.
Building the foundations, aren't they?
Right. Charlotte, I'm curious. I read in an interview of yours that you said, I have not followed the classic university path. Yet, you have always, as far as I know, involved with education. I mean, I'm curious to know what that path was like then.
Yes, I think I'm an absolute example of self-directed learning. I think because this change from dental school straight into a dental school in the UK, that was kind of interesting, because I think all I wanted to do was to be a general practitioner. And now instead I found myself in a hospital, in a sort of combined dental school academic as well as hospital setting. And it has stood me in very good stead. That is also how eventually I became a specialist. But I think I always wanted that general side of things. I felt that I really should be able to do all of dentistry and not just, if you like, prosthodontics or middle prosthodontics in particular. And I think with that, even though I was in a hospital and a dental school setting, I wasn't really attracted into that particular pathway. I was always looking to go into practice. And because of that, I didn't follow the traditional way with taking whichever exams that you would be expected to take. For instance, in the UK, it would be through the Royal Colleges or to do research as such. So I found my own way, and it has been very much clinically based. And it's also perhaps been peer review based as much as anything else. That when they introduced specialist lists in the UK, I could prove through peers being willing to provide tests, to the effect that I could be regarded as a specialist, even though I didn't have a formal education. I had spent my time in hospital and in dental school, but it was more informal rather than a formal training.
Oh, okay. In Charlotte,
knowledge sharing. I don't think there's one point A to point B. It's about changing or having positive impact in people's life, helping them do better what they don't do yet.
Yes. And I suppose what I've also done is I very much followed what I was interested in. And that's worked really well too.
Very well.
Mm-hmm. Okay. Charlotte, we know how serious you can take education. How did you first get involved with teaching? And was this also how ITI entered in your life?
I first became involved with education because I was in a dental school, and some of my colleagues realized that I had been taught in this very strict way in Scandinavia, in Scandinavian design approach, which is very hygienic, it's forward-looking, it's future-proofing for patients. And they were interested because it was quite different to, I think, what was done at the time in the UK. And so they started involving me in courses, both in teaching, obviously, within the dental school, but also in courses for general practitioners outside the dental school setting. And then I became more involved with vocational training schemes in the UK. And at one point, I started working with implants. That was some 12 years after I graduated, I suppose, so mid-90s. Difficult time, there wasn't really anyone to teach you. You had to find some mentors. And one of my mentors was involved with the ITI, was the first 2 ITI fellows, okay, and encouraged me to become more involved with the ITI and also to become a speaker for the ITI.
Mm-hmm.
So that's about 20 years ago. So I've got this thing that says 20 years ago.
Congratulations.
Nice, congratulations.
I've never looked back.
And today you're the president of the ITI,
Yes.
which is an incredible achievement. And in retrospect, not in retrospect, you made history as the very first female president of the organization. I'm curious, 2 things. I won't say that you would just change a gender behavior. I would ask in 2 ways. Do you see a shift already during your tenure, first in the adoption or membership on ITI itself? And do you see an even higher shift now looking at the female representation at ITI?
I tell you that I see across the board, also outside the ITI, many more women coming into presidencies. It's almost as if there has been a conscious shift, that there needs to be a change here.
Yeah.
I am very closely, I work involved in the Women Implant Network. And so working with that, because I can see, as we all can, that women are really attracted to dentistry. They come into dental schools in huge numbers. And I think I'm not wrong in saying that the world over, about 60 to 80% of dentists who are graduating now are women.
Yes. Yeah.
So
here in Brazil too.
Course, yeah, for
Yes.
several
Yes.
generations of women. And what I have seen, I'm not, Christian, if we really start looking at the numbers of women in membership, and I'm not sure how, it's not explosively that it's changed, but I'm not really in any doubt from all my travels that women notice that a woman is now president and that they welcome it. And I think even if it's only an inspiration and saying, well, that could be me. And quite frankly, it could be. Yeah, it absolutely could be. So hopefully that is paving the way for others.
Exactly. I mean, you've been leading by example, and just by looking at somebody that is a pair in gender, in profession, I mean, by itself, it says a lot.
Well, maybe particularly because I've had this untraditional pathway as well. I did not set out to be president of the ITI, that's for sure. And I would never have put myself forward for it. That's also for sure. But the pathway leading there, that could be someone else easily. And it will be in future. Absolutely.
Very nice.
Hope so. But for the record, you earned it. It's not something that just fell from the sky.
Very much.
And with your role as president, I imagine your public speaking engagement have increased. You have this tenderness, but you can also be firm if necessary. I believe that. Is that balance something you worked on? And for young clinician who is aspiring to leadership but have stage fright, what advice would you give?
Gosh, for sure, for sure. The more you stand on a stage, the more you get used to it. I remember, for instance, the first time I ever spoke to camera, I was petrified. I mean, you can see I was almost in pain. And it is quite painful to watch the recordings from that time. I think they're even on the ITI Academy still as we speak. But you do get used to it the more you do it. I think it's really important to prepare well.
Yes.
You're on top of what you're going to talk about, to know that you're not going to run over time, to know that your presentation works, and then to know it well enough to be able to store it on your own hard drive up here. Yeah. So, and then actually I would say that it's good that there's always a certain amount of nerves, if you like, adrenaline. You need adrenaline to stand up there and to remember it all and to deliver it. It doesn't come across at all if you don't have that adrenaline. And so I don't know if I come across at the moment, but don't think other than that there is adrenaline pumping in me now as well, because there always is.
I believe that too, yes.
There is. So I would say to anyone who would like to do this, if you know your subject, if you know, particularly as a clinician, if this is something your research, you know your clinical cases, and you know you can do it, then prepare the presentation aspect well. And then maybe also test yourself in front of friends, people where you really think, I will really value their opinion. But also, Christian, there's such excellent coaches available now, and there are courses. Many places are keen to encourage particularly women now to speak and will offer speaker training, and I have had quite a lot of that. And I'm sure that one can tell from time to time that I do certain things that you think, she learned that on a course, and that would be true. But that really works. Then I suppose now, first time I stood up as president, I realized that I said yes to this. Yeah. So now you just got to do it. So now,
very nice.
Worried, this is it. All right, there are 5,000 people in front of me here in Singapore, but this you're doing.
Yeah.
And there's no argument about it.
Perfect.
Oh, you nailed.
Well,
more than you can chew, but come on, Charlotte. Hey, you chew it all.
You have to. Once you've said yes, you have to.
Charlotte, I would like to shift gears a little bit and talk about something that I know is very close to your heart. It's research and clinical practice, right? And I know you approach this very seriously. And I know also that evidence-based clinical practice require balancing the what I do it, the how I do it, and why I do it. But we often find clinicians struggling to understand clinical findings. That's why, forgive the wording, chewed up information that is very to the point, very pragmatical, very action-based clinical practice, like, for example, the ITI Consensus Conference clinical recommendations. So you have kind of a guideline there that stay within the tracks. You should be evidence-based, or also the ITI treatment guides that are excellent resources are out there for everybody, that it's a must-have. But how do you see we can bridge better evidence-based approach with Monday morning problems in doctors that we have noticed quite a shift? I mean, already back then, it was a bit hard to understand clinical findings and research findings, right? It's research are very, they provide answers to a very specific parameter. Otherwise, you don't get statistical analysis. But they say, well, but I have Monday morning problems that scramble this all up, and I don't really know if this resonates with me. How can we bridge better research findings, being more applicable to daily practice, and then make this more available to every clinician out there, not necessarily following congresses, for example?
Well, I mean, my solution to this has been in the field of implant dentistry to be part of an organization like the ITI, the International Team for Implantology, because it's a network and it's a resource. And so it's a basis of meeting people who are likely to come up against the same issues and to be able to discuss it with them, have people who go to, you know that person is good at this, etc., and then get help that way. It's also, I think, the consensus conferences and the further translation of everything that comes through these consensus conferences is so helpful for us to then implement things in practice and implement them according to principle protocols, etc., and, recommended procedures. But I think what's now coming, of course, is we're all looking at what can artificial intelligence do with something like the wealth of information and content, and not least curated content, that an organization and other organizations like the ITI actually sit on. And then I think we've also gently shifted our focus, because if you work with consensus conferences in the traditional sense, you're looking 5 or 10 years back, because you're always looking at data in the past. Well, the world is moving so fast. For instance, now in digital technologies, things are evolving. What you have this month is perhaps almost out of date in a month's time. So I think we also need to move much more in, and ITI is trying to do this, to be a partner in the now, your academic partner in the now. And so you look at things and say, being honest about it, there is no evidence at the moment. But the way that we would suggest you therefore approach things at the moment is this way, because we don't know much more about it. So you can do it, but be aware that there isn't an awful lot of evidence. So we don't know how well this is going to last, for instance, in the long run. And I think that being more in the now is important, but being honest about what we do and what we don't know, because we are continuously bombarded with new products, new technology, etc.
Right.
And I think we need, as an organization, also to help our members and to help the dental profession as much as we can with that.
I like what you say about the now. For example, the now, I believe, with all honesty, that this whole sense of, first, camaraderie, but this relationship of mentor-mentee, it's really something that amazing things can happen, because you combine the experience from somebody who's been in this path for many years, has set solid foundations, has established workflow that are evidence-based, and is willing to spend time. We can also maybe reflect about the scholar program that ITI has.
Yeah. Well, I mean, I frequently now find myself in the situation where I am the mentee, because the younger generations are much better at adopting the new digital technology. But where we sort of come together, and maybe instead of just being mentee and mentor, we actually become sparring partners, is when maybe I come with the principles and they come with the technology and the workflow, and then we put it together. Because with something like the digital workflow, it's very tempting to think this is really the solution to everything. But it isn't. It's a tool. It's a tool that we use instead of the way we use the tools in the analog world. And the principles, as you said, Christian, the why and the what are still as important as they ever were. And actually, those principles are still the same, even though we move from the analog to the digital world. It's just, the digital world to me is a change in how.
Yeah.
It's true.
I see this with great, it's a great shift. Workflows, especially with technology, we're living an amazing shift that is a bit overwhelming sometimes. And the inclusion, as you said, artificial technology, artificial intelligence, and all these many digital equipments that are meant. I was having a conversation, for example, with Galucci, that never in history we've had the opportunity through digital technologies with amazing amplified structures, 3D positioning, that we can have more assertive planning, or the opportunity for more assertive planning by having perspective that, for example, I never had when I was in implantology, where we only had panoramic X-rays and maybe telecephalogram radiograph that we have to put a math to speculate the width of that bone. Now we have everything magnified, already telling you densities. So as workflows are getting more complex in different brands, different materials, and I saw during EAO, and I heard about this GCCG, the Global Consensus for Clinical Guidelines. what is this and why is it coming together now? How do you see the importance of?
Well, I think we have felt for a period of time for some years in the ITI that it did not really make sense that many different organizations had their own individual consensus conferences and perhaps asked pretty much the same questions of the literature and came up with pretty much the same answers. And it's sensible to pool our resources. And in the meantime, two other organizations had decided pretty much the same, but they'd actually gone one step further, if you like. They decided that what they would do is to look specifically at the various indications that we have for tooth replacement. And the first one of what might become 7 consensus conferences over the coming years is addressing the edentulous maxilla, because that seems to be an area that is a lot of interest in around the world. So we're kind of looking at, it is definitely a patient who has an edentulous maxilla. It's not a patient who's about to lose teeth. So from a periodontal perspective, if you like, the deed has been done, the teeth have been lost. Now it's a question of what are the guidelines then when you're looking at selecting the patient, or rather selecting the right option for the patient? What will be the digital workflow, or the digital tools that you might use to help you with planning? What will be your treatment planning, your treatment procedures? What are the guidelines in terms of maintenance? And what do we have to say about complications? And then it's an innovative new format where a number of organizations come together so that you actually get, if you like, stakeholders who can disseminate these guidelines afterwards all the way around the world. So for instance, LATAM is also represented in this alliance that are coming together for these global consensus clinical guidelines. And it will also have a view from not just people in the consensus conference, but from clinicians who've contributed through Delphi survey that they have answered and provided information from. There's also information from stakeholders, such as the patients themselves, and also people who are involved in implant dentistry in other ways, for instance, industry.
Looks like an amazing initiative.
It is an industry, and we are very pleased to have joined it and be part of it.
And what can we expect in terms of timelines that will come towards us?
The consensus conference is taking place in Boston next June. So it's a question of how quickly the guidelines are then published after that.
Oh, good. Amazing.
Charlotte, we had to speak a bit about the whole environment in which you're in the middle of the context. Now I would like to bring the spotlight back at you. In May, as we know, you will pass the baton to Ronnie Young, the presidency of the ITI. But I'm sure you have a backpack full of memories and remarkable moments. And I'm curious, I mean, could you share maybe, let's put a number, maybe 2 of the most memorable and touching moments that was like for you that you say, this I will never forget?
Well, I will certainly never forget that it was during COVID, and I was becoming president online, not in, face-to-face event as it would normally happen. It was online, and it was a handover from Stephen Chen to me. And just as my mic went live, the window cleaners turned up and absolutely smashed water and brushes and things against the window right next to me. And I was furious and sideways at the window. And there was nothing I could do. So for the whole time that I was live, in this online meeting going out to the whole world, it was very noisy. That aside, I think the absolutely overpowering thing that will stay with me, and I hope that I'll just be able to sit down and digest all these wonderful, wonderful experiences I've had. But to be allowed to meet your professional colleagues all the way around the world. And then because most of the time it's been in conferences as well, you actually have an opportunity to really get to know people because you spend 2 or 3 days together. But for me to really go out there and meet the ITI world, meet members, each different members in all these different, well, we have 37 sections now. That has been a tremendous experience. Absolutely. A humbling and tremendous experience, and that will stay with me forever.
No.
Thanks for sharing that, Charlotte. And I'm sure you're going to still have many other memorable situations until May. We still have 5 months.
Oh, yeah. No, definitely.
Maybe someday we'll top this one now.
Yeah, there's some more wonderful travel coming up as well.
Charlotte, now we start the human in me, a rapid fire section. Ready? Okay, let's start. Dentistry for me is?
Oh, it's been an identity for me, and it's been a vocation. And my daughter would say, it's been my hobby too.
Proactivity means?
Oh, being proactive is taking a grip on things and steering your own life forward, I think. Always looking at, is this the right thing for me? Am I doing my best? Am I able to do my best? Could I do it differently if I change something? So being proactive about things has always been good for me.
Oh, nice. A challenge I have?
Well, a challenge I have is perhaps to not speak for too long at a time.
Nice. My favorite singer?
My favorite singer, yes, I was, who would that be? I think there's a Danish band, so not just one particular singer, but a Danish band that I always feel such good mood when I hear them. They were from the 80s and they were called Shubidua.
Okay.
Shubidua.
Shubidua.
Nice.
A song in my head today. Do you have?
A song in my head today. That's more difficult. That's more difficult. There is some, well, there has been, because it's Remembrance Day, or was yesterday Remembrance Day in the UK, and I think in many parts of Europe. And there's a particular hymn in the UK that's called Jerusalem. And that always, for me, it's very moving. And it also somehow really signifies this thing that I have moved to this country and I've taken on this country as my second country. And so I feel very attached to that.
Nice.
My favorite movie?
Right. There are many.
No.
But I think I can tell you that, and I often see them many times, but the one I have seen the most times, quite shockingly the number of times, is Sound of Music.
Sound of Music, nice. A podcast.
What was it?
Sound of Music.
Sound of Music. Oh, lovely.
I've seen that too many times to really admit it.
A podcast I enjoy?
There's a podcast that I enjoy enormously called The Rest is Politics. That's one that's running in the UK. I think there's also a version that's been running in the US. I find that really interesting.
I like the name already.
And one hobby?
Non-dental.
No dental. Yeah.
Well, one hobby. I used to ride horses, and I used to be a very keen horse rider. That doesn't happen so much now. And now that my daughter has perhaps passed on this thing that dentistry is my hobby, I think my son might say that it's football now. I'm keen. I'm an avid football watcher.
Oh, nice. 3 bucket list places are to do.
I have not got as far as New Zealand yet, and I would like to visit that. I would like to explore Italy more, and I think I'd also like to just get in a car from home, if that's still environmentally friendly, all right, and explore Scotland.
Oh,
nice.
Nice. I love Scotland. And the last one, my family.
Ah, my family. Yes, they've been very patient with this, my dedication to dentistry. But I have a son and I have a daughter, and they're both married. And my daughter has a little girl who's a year old now. She was born in the middle of an ITI board meeting. That's, of course, how it is, isn't it, when you're doing your work-life balance. And my son has got married recently, and to a Brazilian girl from Uberaba. And they have recently moved to London. They were living in Toronto together, and now they're living in London. And they have what my son refers to as my other granddaughter, but it is a dog. It's a canine granddaughter. And with that, I feel my life has been so truly enriched that sometimes, you have to pinch yourself. Wow.
Yes, this is true. Thank you. Chris?
Charlotte, I can and I could not thank you enough. I'm biased because you are, for me, somebody I always look up to, and you have always treated me, I'm sure, the same way you treat everybody else, with nothing but respect, kindness, and true leader as you are. I can only thank you on behalf of the DentalUnit podcast for taking the time to join us and clarify all these questions and share your life with us. Thank you very much.
Thank you very much both for having me. It has been a real pleasure.
Oh, thank you, Charlotte, for being here. Thank you for kindness and for being this inspired woman in dentistry. Thank you very much.
Okay. Bye-bye.
And thank you. And to all of you out there who watch this episode and you think it's valuable, please, as you know, any content online, we need you to give it a like and also to recommend to a friend. On behalf of the entire DentalUnit podcast team, thank you very much, and we see you in the next episode. Ciao.
Bye-bye.